Can I have my breast reduction under local anesthesia? So can you do my breast reduction under local anesthesia or a little sedation? Generally, it's not a good idea. Usually you are most comfortable under general anesthesia, which is very safe, and you can have it done and sometimes even go back home the same day, depending on the extent of reduction. But getting it done under local anesthesia, although possible, is usually not a great idea. Will insurance cover my breast reduction surgery? So I practiced for many years in the US, in the greater Boston area, and there a lot of the breast reductions were covered by insurance. But you had to remove a certain amount. So if you have, say, X size, you have to remove 500 grams or 300 grams, depending on the insurance. If it was less than that, then the insurances would not cover it. However, in our country, in India, breast reductions are generally not covered. In an occasional individual, breast reduction may be covered by insurance, and you should talk to your insurance about it. If it can be covered, by all means try to have it covered. It is both a reconstructive and a cosmetic procedures. So there is some logic to having it covered by insurance because your back feels much better, your shoulders feel much better, and you have much less pain and discomfort. So talk to your insurance, see if they can cover your breast reduction for you. What are the common complications of breast reduction? Well, when we talk of complications, some are common to most surgeries, just like bleeding, infection, delayed healing, and so on. Some of them are actually more specific to breast reduction, and that is change in nipple sensation. It is less than 1%. Very rarely will you have a change in nipple sensation, either less or more. I see it very, very, very rarely. So I would not call it a common complication, but yes, there is a possibility. Also, if your surgeon is not very careful and is not well experienced, there can be a problem with circulation, especially of the nipple areolar complex that we call NAC. So make sure your surgeon is competent. You don't smoke, because smoking and diabetes are risk factors as well. You will have very few complications or chances of complications. If it is a little bit longer to heal, that is possible. But otherwise, you should be fine. Do I need to spend a night in the hospital or in your facility after a breast reduction? And very often you can go home the same day, depending on the extent of reduction and your own comfort. Very often it is done as a daycare procedure and works out well. Sometimes you need to stay for one night, and that's fine as well. You can go home the next day. More than that is rarely ever needed. So depending on how you feel, how your surgeon feels, you may be able to go home the same day or the next day. Can I wear an underwire bra after breast reduction? Well, for the first few months, it is uncomfortable and it will not be an appropriate thing for you. For at least for the first 3 months or so, do not wear an underwire bra. You can wear a bra with no underwire, regular bra with no underwire, or you can wear a sports bra, and that is appropriate for about 3 months or so. After that, an underwire bra is fine. Is it possible to have a tummy tuck and a breast reduction at the same time? Absolutely. Very often we do this because some ladies who've completed their family will have very heavy breasts, and the abdomen also is very loose and has weakness of the abdominal wall. Very often in that situation we do a procedure we often call mommy makeover, and with that you can have your tummy tuck and breast reduction or a breast lift done at the same time. How long does it take for a breast reduction surgery, and how soon can I get back to work? So depending on your surgeon, his or her experience, the reduction surgery, breast reduction surgery may take anywhere from 2.5 hours to 5 hours, but the length of the procedure is less important than its safety and the actual eventual results that you will get. As far as how soon you can get back to work, if it is basically working on a computer on a desk, you can get back to your work as soon as a week. But in terms of somewhat more involved work where you have to get around, move around a lot, then maybe 2 weeks. No heavy lifting for 6 weeks, however. So if it's a very strenuous work, give yourself more time. If it is desk work, much less.